From KLCC Studios, this is Oregon on the Record.
I'm Michael Dunn. A decade ago, Lane County reached a very inauspicious milestone. It had more fatal car crashes than any other county in Oregon. The alarm bell sounded, so in 2017, the county created a new entity dubbed the Fatal Crash Investigation Team, or FCIT. The ultimate goal of this new team was audacious: try and reduce fatal car crashes to zero. Well, a decade later, how's the effort going? That's what we're going to find out today on Oregon on the Record. Our guests from the county and FCIT will tell you about those efforts to use a combination of educating the driving public, utilizing laws and law enforcement to change bad driving behavior, and engineering to make our roads safer. Our highways and byways are not just a shared resource, but a shared responsibility for safety, and one small deviation in driver behavior or bad road design can have profound and even deadly consequences. The Fatal Crash Incident Team, or FCIT, was formed in 2017 because in previous years, Lane County was the most dangerous county in Oregon to be a driver, and we're going to talk with one of FCIT's team leads, as well as the county's public information officer, to discuss what they're doing and how they're doing to make it safer to drive. Lane County's Senior Transportation Planner, Becky Taylor, and Devin Ashbridge, Lane County's Public Information Officer, thanks to both of you for coming on the show and talking with us.
Thanks for having us, Michael.
Yeah. Well, Becky, let's start with you. Can you tell us what the Fatal Crash Incident Team is and sort of why it was created?
Yes. So it's actually called the Fatal Crash Investigation Team.
Thank you.
Or the acronym goes FCIT.
Okay.
Lane County created this team shortly after the Board of County Commissioners adopted our first Transportation Safety Action Plan. And at that time, we made a commitment to work towards zero deaths. And that's consistent with the National Strategy on Highway Safety. To work towards zero deaths on our roads, we realized that we needed to bring together different disciplines to address this complicated issue. So the team consists of members from the Sheriff's Office, from County Council and Risk Services, some public health representatives, and staff from Public Works in engineering, road maintenance, and transportation planning. And we meet monthly, and we discuss the fatal crashes that have occurred on county roads with the intention to explore potential interventions that could help prevent future crashes.
Okay. I guess, sort of the why as well of how this team got created. Kind of, can you give us a picture of, I believe you started, like you said, in 2017, or you formed. How bad was the situation prior to 2017 and the need to create this organization, this department?
Yeah, so I mentioned we adopted a safety action plan in 2017, but we actually began our safety planning work back in 2015 when we got state grant funding to explore safety issues. And we were kind of shocked at what we found, what we discovered in looking at all of the crash data back in 2015. We learned that most of the fatal crashes are happening in rural Lane County outside the cities, even though there's less traffic and population in the rural area. And another big surprise is that Lane County had the unfortunate record of having more fatalities from traffic crashes than any other county in Oregon.
Wow.
We also learned that fatal crashes was a leading cause of death for children. So since then, we've continued in terms of whether this problem's getting better or worse. Unfortunately, we continue to rank within the top 3 counties in Oregon with the most fatal crashes. There's been some slight fluctuation in the number of fatal crashes each year, but there's really been no noticeable reduction in deaths. On average, between 2015 when we started our effort and as of 2022, just looking at the data from 2015 to 2022, if you average the number of deaths that have occurred just from crashes on Lane County roads, about 12 people lose their lives each year. And again, most of those occur in rural Lane County, and there's often not a lot of media coverage about those crashes. They kind of go unnoticed. And so again, I appreciate this opportunity, Michael,
Yeah,
to help
yeah.
educate the public.
Well, let me do a quick
Um,
reminder to the listeners that we're talking with Becky Taylor. She is the senior transportation planner at Lane County, and joining her is Public Information Officer Devin Ashbridge, also of Lane County. And sorry I interrupted your thought, but I mean it's obviously, it sounds like rural Lane County is really kind of the hotspot, and continues to be.
the leading cause of fatal crashes on our county roads is driver behavior.
Hmm.
We look at all of the contributing factors in the crashes, and we've realized that excessive speed is involved in all of those crashes. And there's a growing trend of seeing more intoxication, so involvement of substances, drugs, and alcohol. Those are the leading contributing factors. We're also realizing that distraction and aggressive driving appear to be on the rise.
Hmm. Hmm. Yeah, I'm going to bring in Devin here too about, and something Becky talked about is, a lot of these rural fatal collisions don't necessarily rise to the level of media attention, and so they kind of go unnoticed. And how have you attempted to kind of, raise this in some ways a crisis, so that more people understand how, challenging rural driving is in Lane County, and how it leads to such, disaster, such fatal outcomes?
It is difficult to change adult behavior. That is a challenge. And so we try to focus on smaller audiences. So, for example, in a previous summer, we worked with the Lowell Rural Fire and Protection District because they respond to a high number of crashes, including serious injury and fatal crashes out in the Lowell area. Highway 58, although that's not a county road, sees a pretty high percentage of incidents. And we really wanted to talk about what that means for younger drivers.
Yeah.
And so the fire chief and our chief deputy, we helped create some PSAs that we then placed as advertisements.
Okay.
The challenge is not using our limited resource to duplicate efforts that are already being done, often in a bigger and better way than we can afford to do them as a small agency. So there's a lot of education around not driving under the influence. We don't necessarily need to weigh in on that in a big way.
Okay.
But where we have chosen a niche area would be the London Road Safety Corridor. London Road, and Becky can talk more about that, is one of our roads that sees a huge proportion of our serious injury and fatal crashes. And so focusing in that area on some of that messaging. So we're trying to be smart with where we spend our time, and try to actually look at areas in Lane County we might be able to make.
Well, Becky, talk about that. Talk about the London Road corridor that Devin just teed up there.
Yes, that was a new initiative that the FCIT took on. The state legislature created a pilot program. Previously, the safety corridor designation was only available to state highways, and the legislature opened up the pilot program to invite counties in Oregon to designate certain roads subject to crash criteria and other factors. You had to apply, and it was somewhat of a competitive process to get this designation. Lane County selected a road that had the most fatal crashes for many years, and that's London Road, south of Cottage Grove. We made our application, and the state committee approved it. We installed the safety corridor signage, and then a big component of the safety corridor designation is the ability to double traffic fines. And so, just to be clear, that's not a sufficient revenue generator. The intent of that is really to influence driver behavior. And so, and that seems to have influenced driver behavior. We usually had at least one fatal crash every year on Linden Road. And since the designation 2 years ago, knock on wood, there hasn't been a fatal crash on the safety corridor designation.
Sounds like, in the signage and maybe that gets to that idea of enforcement, obviously, kind of carrot and stick with drivers. Does that help a little bit? Does it kind of help, kind of incent drivers to say, I better slow down because I might get a ticket?
Yeah, I mean, so knowing that the problem is driver behavior, it's so hard. Behavior change is really a complicated
Sure.
challenge. So, I mentioned that the FSIT brings together multiple disciplines, and we refer to that kind of emphasis on different disciplines. We call it the 5 E's of safety,
Hmm.
and those reflect different interventions to prevent fatal crashes. So the 5 E's, they stand for engineering, education, enforcement, emergency response, and then through all of our implementation actions, we consider equity. Um, so, I mean, we know that people make mistakes. And so our prevention approach is really to build this system of prevention
Okay.
with multiple layers of interventions. So with engineering, the
Well,
engineering E is the thought there is we can make our roads more forgiving of human error. Crash type in our fatal crashes is roadway departure. So people are driving on the road because they're driving off the road
hmm.
because they're driving too fast or they're intoxicated or they're distracted. And so an engineering method to be more forgiving of that human error is called a rumble strip.
Mm.
And those are indentations in the pavement along the center or the sides of the road. And so when someone's leaving their travel lane and their tire hits that grooved pavement, it makes a vibratory um, and noise that helps alert the driver that they're leaving their like pay attention, get back in your lane. Um, and then I was talking about the 5 E's. So that's the engineering E.
Hmm.
The education E, that's not only about teaching people to drive safely, like driver education, which is something that we lack in rural Lane County is driver education for youth. But the messaging to the traveling public to be aware of risks that they take when they drive too fast or drive under the influence. And then with most of the fatal crashes in rural areas that are more remote from medical care, the E of emergency response, that's the third E, is critical to saving lives. And then with all of these interventions, I mentioned we consider equity, and that means considering the affected population. So, for example, with the London Road Safety Corridor, we looked at demographic information of people living in the area. We wanted to make sure that wasn't an area where median household incomes were really low and that there would be a significant burden to fees doubling. So just something that we pause and consider when we're thinking about how to bring together all of these interventions to influence behavior change so that people will drive more safely and will save lives.
Sure, sure. Uh, Reminder to our listeners, we're talking about fatal crashes in Lane County, and we're speaking with Becky Taylor, who is a senior transportation planner, and Devin Ashbridge, a public information officer with Lane County. Devin, talk a little bit, if you could, about, kind of how the county commissioners are sort of plugged into this issue and kind of ways in which sort of from their leadership position, kind of helping to make our roads safer, and certainly the implementation of this team, and kind of give us kind of the how they've sort of been able to be educated themselves and look at it from a law implementation standpoint about trying to make this problem a little less.
Sure, Michael. The Board of County Commissioners is very aware of this as an issue. Becky and her team report to them quarterly during their public meetings to talk about what we've seen on our roads over the last 3 months and what measures are underway, whether that's a project update or talking about which grants to pursue. So they're very plugged into this and are concerned, and rightfully so, about, we want to be number one in some categories, but this is not a category we want to be
Yeah,
anywhere near
absolutely.
the top of, right? And so I think they've done a really nice job in providing that policy level support that helps Becky and her team go after grants
Hmm.
to do that more expensive work. And I know that it is probably one of the just unsexiest things about government work, right? But the data crunching and the evaluation and the work that the fatal crash investigation team does gives us the data that we need to show that we have an issue here and be competitive in pursuing grants so that we can go do some of those engineering improvements,
Yeah.
things that would be, outside the scope of our local funding. So they're supportive. It's a concern, and they do regularly look for ways where they can and lend more support to Becky and that team.
Okay. Okay. Becky, back to you. I'm just wondering. Obviously, so much of your work is in data, and I'm wondering. Obviously, something like COVID and how many people stopped commuting to work or stopped going to the farms or factories where they worked. What did you see in terms of looking at, say, the height of COVID? Let's say the bulk of 2020. Just by virtue of not having as many people on the road, did that obviously correspond to less fatalities on those roads?
That's such a great question, and it's such a complicated question. I don't know if we know exactly what happened, but there definitely was a spike in fatal crashes in 2020.
Hmm.
And it was difficult to detect at first because there was a reduction in the overall number of fatal crashes. But when you compared that to that number to traffic volumes, which also dropped,
Mm-hmm.
there was actually a spike in the
Hmm.
fatal crash rate. And our thinking is that people were driving faster with fewer cars on the road. Um, and again, I mentioned there's been a growing trend in drug and alcohol presence in crashes, and um, that could potentially be pointing to other potential mental health issues, potentially related to COVID.
This concept of zero fatalities. I mean, it's an incredibly audacious goal. I guess if you could sort of quarterback for us, what do you think is that even possible, given that so much of what you're talking about is really changing human behavior that unfortunately for many of us is sort of ingrained?
Thank you for mentioning that. Getting that message out, I think, is huge about the risk of going faster, what the potential consequences could be there. So this concept of zero fatalities, or working towards zero deaths, is to recognize that deaths on our roads is unacceptable and it is preventable.
Hmm.
Um, we call them crashes rather than accidents because most of the crashes are preventable. If someone would have paid more attention to safer driving, accidents happen, and that leads to people not taking accountability or just accepting it as a cost of our mobility. So it's really a way of recognizing the problem and working toward um, solving that problem.
Yeah, yeah. I mean, even some far-flung ideas. I mean, obviously, people have been talking about this idea of autonomous vehicles that drive themselves, and I know part of that thinking is a computer might be able to sort of wring out, obviously, the human element that we've been talking about. I mean, maybe autonomous vehicles is still a ways off, and we're getting towards the end of the program, but I'm trying to link that to how can we sort of, for lack of a better phrase, wring out the human error in judgment of, like you said, taking intoxicants before we drive, not driving too fast. I mean, is there, other than just continuing education, and maybe that's a big part of it, what can we do to make us safer drivers? I mean, that's my last question to you. What can we do?
Well, about autonomous vehicles, I agree that with the greatest risk being driver error, systems that intervene can help. I think what people can do to be safer is just be mindful of the risk and to make safe decisions. Driving too fast and passing other vehicles unsafely creates significant crash risk that can result, in a minimum at hours of delay exchanging insurance information with the other vehicle, weeks of delay and related expense with auto repairs, or, months to lifelong injury or death. It's just not worth that perceived travel delay or getting somewhere faster.
Yeah.
So specifically what people can do to be safer and prevent fatal crashes and serious injuries is maintain safe speeds, drive carefully, turn off your cell phone, wear your seatbelt, and designate a sober driver.
It's basic advice, but boy, it's probably the best advice that we could ever undertake when we get behind the wheel. We're going to have to leave it there. I really want to say thank you to Becky Taylor, a Senior Transportation Planner, and Devin Ashbridge, Public Information Officer for Lane County, talking about our problem of fatal crashes and what we're trying to do to make our roads and ourselves safer. Thank you both so much.
Thank you so much, Michael.
That's a show for today. As you heard, education, enforcement, and engineering are the keys to making it safer to drive. There's a lot experts can do to engineer safer and better roads, and enforcement can go a long way to curbing the worst offenders on our roads. But educating ourselves about being better, more alert, and more proactive drivers might be the most important thing in greatly reducing fatal crashes in Lane County and everywhere else. I want to thank both Becky Taylor and Devin Ashbridge, PIO for Lane County, for talking with us. This show, along with all episodes of Oregon on the Record, is available at klcc.org. I'm Michael Dunn, and this has been Oregon on the Record from KLCC. Thanks for listening.